So we're going to talk now about blood testing, okay, and normal versus abnormal blood testing. This is pretty key, okay. There's two ways to look at it, and we're going to talk about how we do this, okay. So have you been told all your lab tests are normal? Okay, a lot of people have. Typical lab ranges are not reliable, okay, and we're going to talk about this here in just a second. Okay? The ranges can vary from lab to lab, city to city, and that's just the way it is. Right? They use bell curves based on unhealthy people. Right? So to talk about this, ranges vary from lab to lab. Okay, this is because the labs set their own values. Okay, and they change periodically based on the amount of people getting blood work done. So somebody that has a thyroid disorder, they're getting their TSH checked maybe every 3 to 6 months, okay? So you've got an unhealthy person getting that TSH level checked regularly, and then what happens is the lab set their ranges and they actually use bell curves. They want majority of the population to be right under that dome or that bell, and then you've got a few people out on the far high and the far left, but what they do is they shift that bell curve one or the other so that the majority of people fit under it, okay? And those change all the time. And here, LabCorp request, any lab test, it doesn't matter. They set their own values and they change it based on the people coming in. And unfortunately, people that are getting their blood sugar checked regularly or somebody's getting their thyroid checked regularly, all right, those are unhealthy people. So they skew the normal ranges, right? So for instance, how it can differ from city to city is we look at here a graph in Los Angeles. We look at a blood any blood marker here, and we see that the normal range is somewhere between 7 and let's say 13.5. Okay, and we look at the same blood, and we're looking here in Chicago. Their normal range is between 6 and 14. Okay, so let's say somebody comes in and they get this particular blood panel run. Let's say that their numeric number is 14. Now in Los Angeles, they may say, okay, there's something going on, and you may get a prescription for something to affect that. But if you're in Chicago, you could actually fall into that normal range, and your doctor may say, hey, everything looks good. Okay? And that's your reality. So you can bump around from city to city and get the same blood work done, and it actually can be abnormal or normal based on the city you're getting that blood work drawn at that point in time. Okay? So, functional lab values are more sensitive. Okay? They're based on healthy function, so you can reveal problems before they're seen on traditional lab tests. Functional lab values are set by the American Society of Clinical Chemists. Okay, that's one of the agencies that set the functional lab values. This is important, okay? What this is they take what a normal, healthy individual should have, and that is the range that they set that for. So all they do is they take the lab range that you're getting done at your LabCorp request, and it's shrunk in, okay? And it's a great way to detect disease processes or breakdowns before they occur. Right. So have you been told all your lab tests are normal but you still feel sick? So here's a traditional lab range. All right. So we've got our abnormal low, our abnormal high. These are our disease ranges, and then we've got this range right here. All right. Or we've got the healthy range or the functional range. Okay. So on your LabCorp request, this is the range of the numbers that your doctor is using, versus squeezing that in and looking at the functional perspective, which gives us a more accurate depiction of what's going on. And I'm going to show you a sample blood panel right here in a second, okay? In these subclinical ranges, okay, this is what your doctors are using, okay? In these areas, lab findings that most MDs would consider normal, right? So if you have a thyroid stimulant hormone value that comes back and you're in here, they may say, hey, we're doing good, but from a functional perspective, you're not good, and that's possibly still why you're having symptoms. So maybe you just need your medication altered, and that's the reality of it, okay? Typically, if you're still in here, you're still having symptoms, and that's what we see all the time. What this really means, to look at another perspective, is these are the inaccurate lab ranges, and this is the normal lab ranges, okay? So everything not in this green range is normal. So if you're in a inaccurate, or if you're in the standard, you're sick, and then you get here, you're actually in a disease process, and we call this area, it's a little too late range. Okay, so it's actually your body's broken down so much that it's a disease process where you may have been in a subclinical standpoint for a period of time, and it could have been driven back to this functional range. Okay, it just takes a little bit more work to get there. All right, so let's look at some a sample blood test here. Okay, here's an example. Let's say a patient go gets their blood test done. All right. Let's say their glucose is 73, their TSH is 4.2, their triglycerides are 149, and their hemoglobin is 13. If we look at from a traditional standpoint, from LabCorp, 65 to 110 is normal. All right. So blood sugar 73 is normal. TSH of 42 is normal because 0.3 to 5.5 is considered the normal range. Any triglycerides under 150 are normal. Right. Hemoglobin, 12 to 16, normal. We look at it from a functional perspective based on the values that the American Society of Clinical Chemists set for a normal, healthy individual. We see that actually a blood sugar of 73 is actually a hypoglycemic state. All right. Somebody with a TSH of 4.2 actually still has hypothyroid presentation. Somebody with a triglyceride count of 149, they actually have an insulin resistant state going on. And somebody that comes in and they're female and they have a anemia marker of 13, they're actually anemic. Okay, a hemoglobin marker of 13, they're actually anemic. All right, so this person may have went to their doctor and they say, well, you're on Synthroid, we can't adjust your doses, everything looks good, and I don't know why you're still feeling bad. You just have to learn to live with it, or that's a normal aging process. That's what happens when you get old. All right, that's not the case. From a functional perspective, there's a whole lot that can be done for that person. And that's what we do here in our office. All right? We take a functional approach versus a conventional approach, and it changes people's lives every single day.